Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in beautiful sunny Phoenix and Scottsdale, Arizona. Today I'm out at the Packard Baseball Stadium for ASU, which has been the home of ASU baseball for about 40 years almost. And it's fallen into... Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm out at Packard Stadium at ASU, which is home to the baseball team and has been since 1974. The team has won 5 NCAA championships. They produced almost 100 Major League Baseball players, such as Barry Bonds, Dustin Pedroia, and 90 some others. And they really have been successful. The stadium has fallen into a little bit of disrepair. It needs about $20 million of work. As a result of that, the university is signing a deal with the Chicago Cubs to share a stadium in Mesa. That stadium will cost about $84 million and be done around 2014, and ASU is slated to pay only around $2 million of that cost. So it's a very good deal. The topic for today is obesity and pain. There have been studies over the decades that have linked the two together, but a recent study out of Stony Brook University in an unbelievably large number of patients has cemented that link. So I'm going to get you guess how many people they looked at in the study. Let's say some ridiculous number like 1 million, and then 30,000, and then 2,000 patients. So which of those do you think that they looked at? 1 million! They looked at the records of 1 million patients to see what percentage was obese, and of those, who showed more pain. And the answer was that 63% of the patients were either overweight or obese. And that's consistent with the general population. 2/3 of Americans are either overweight or obese. You might not believe that, but it is true. And they do that by body mass index and whatnot. So once they established that, then they started looking at the levels of pain in the various groups of not overweight, overweight, and they classified into multiple groups of just how obese people were. And what they found was that even patients who were just slightly overweight had over 20-some% more incidence of pain than the general non-overweight obese population. And this was not just pain from, you're overweight and you have more stress on your joints. They came up with 3 theories as to why obesity and overweight cause increased pain. One was just that. If you're overweight, it can lead to increased amounts of arthritis and increased stress on those joints that have arthritis and can lead to increased pain. So think about that. If you have more stress over the same surface area in your joint, and you even only have a little bit of arthritis, but a lot more weight going through the joint, it's going to hurt more than someone who is not substantially overweight or obese. So that was number one. The second one is they theorized that there is a physiologic process that occurs from being overweight or obese that causes the person to be more sensitive to pain. So that needs to be fleshed out more in further studies. The additional link they think is that there's a link between being obese and depression is often linked to pain. So you have two, A to B to C, the transitive property of obesity to depression to pain. And that can be worked out with some further statistical analysis, but that was one of the theories that came out of this study. Big numbers in patients who are overweight or obese, definitively showing the link between obesity and pain. So that's why if you are having pain and overweight or obese, part of a comprehensive treatment plan would hopefully be to exercise more, watch your diet, and be able to hopefully shed some pounds in addition to standard pain management treatment in order to get the best outcome. Lots of information on our website at preferredpaincenter.com. Call us for appointments at 602-507-6550. I'm Dr. David Greene, Preferred Pain Center. Your pain stops here.